Thank you, Senator Cortez Masto.
Thank you. Thank you to Chairman and Ranking Member. And I appreciate the panelists. Thank you all for being here. The theme of this hearing is considering meaningful solutions to rising healthcare costs. But as my colleagues have stated, we are 6 weeks away from premium spikes hitting millions of Americans and having a devastating impact to them and their families on healthcare. We know what needs to be done to avert the upcoming cost crisis, and that is to extend the ACA enhanced premium tax credits. Listen, my colleagues across the aisle, they say they will negotiate with us on health care. I look forward to that. I hope that's the case. I know some Republicans that I am talking to are taking this opportunity seriously, and they're willing to work across the aisle. We remain ready to do so. But I just have to stress, open enrollment is happening now, and our families are questioning whether they can afford health insurance next year. So they deserve action now, and as we work towards a long-term goal of addressing the health care crisis that we have in this country. Is it Levitas?
Levitas.
Levitas, thank you. Mr. Levitas, let me start with you. If the current ACA premium credits expire, premiums rise for millions in January. Some bipartisan ideas are floated around, like ensuring tax credits don't go to high earners, seem within reach. In your view, which reforms can realistically be made in the short term time before we destabilize our markets?
Thank you for the question. I believe that the only option to help people like Mr. Armitage that can be in place for this year is simply extending the enhancements. Even a change like changing the parameters of the premium tax credit would require building whole new marketplace systems, changing them and deploying them. That can be done, but it would take many weeks or months, and by that time the open enrollment period will be over.
So there's an opportunity to extend it for a year so that individuals like Mr. Armitage and in my state still have access to health care when they need it, particularly for themselves and their children, but we can also look to long-term reform goals as well. Is that what you're saying?
That's exactly right.
In that year period? No. Okay. Let me ask you this. If premium support, let me take this back. I've heard a lot of proposals, and one of the proposals has been promoted over social media. Let me ask you very honestly to respond to this. Would a check in the mail guarantee coverage of pre-existing conditions?
No, it would not, and it wouldn't be nearly enough to avoid catastrophic health care costs for people with pre-existing conditions.
Would sending checks directly to consumers reduce underlying health care costs for individuals?
No, it would not do that. Indeed, there's evidence that things like FSAs increase healthcare spending.
So just to be clear, and let me open it up for anybody else on the panel, we are 6 weeks away from major premium hikes. Do you see risks of trying to launch an entirely new subsidy structure in just a few weeks? Does anybody see the risk in that, or do you think it can be done in a short period of time?
Just to put the issue in perspective, the underlying ACA subsidies continue after this year, and the vast majority of enrollees
I'm not talking about
subsidies.
The underlying. I'm talking about the reforms that have been proposed, and the one I'm even talking about from the administration. They're total reforms to the ACA. Can they be done in a short period of time? That's my concern, and I think that's what we're saying here is that individuals are going to lose health care. This is a cliff. This is an off-ramp. It's a cliff. So we have a responsibility to at least provide them with some sort of off-ramp if we are going down that path. And that means that we extend these for a year so people can access health care and then look and study the reforms that we think are necessary to address some of the concerns that we're hearing out there. But it should be a thoughtful process and not putting people over a cliff. And I think that's the concern I'm hearing from my colleagues as well. I appreciate the panelists. Let me just finally say, I look forward to working with my colleagues. I think there's something that can be done. We've done work here in a bipartisan way to address health care, and I so appreciate it. Now's the time to get it over the finish line and continue to work together. Thank you.
Thank you.